Welcome to my channel RX Sam 2020. Today we discuss a drug named Liraglutide. About Liraglutide belongs to the class of antidiabetic drugs, primarily used to treat type 2 diabetes mellitus in children above 10 years and adults. Diabetes mellitus is a metabolic disease that causes high blood sugar levels. Type 2 diabetes occurs when a hormone released by the pancreas to lower blood glucose called insulin is secreted but unable to get utilized by our body's cells to produce energy. Liraglutide contains liraglutide, a recombinant deoxyribonucleic acid, rDNA, which works by increasing insulin release from the pancreas during high blood sugar levels, after meal, and decreases the amount of sugar the liver makes. Liraglutide also slows stomach emptying time, thereby reducing appetite and promoting weight loss in an individual. Medical use. Liraglutide is a medication used for the treatment of type 2 diabetes or obesity. Contra-indications. Hypersensitivity. Personal or family history of medullary thyroid carcinoma, MTC, is cancer of the thyroid gland that starts in cells that release a hormone called calcitonin. Multiple endocrine neoplasia syndrome types 2, MEN2, is a rare condition. It causes tumors in the thyroid and parathyroid glands, adrenal glands, lips, mouth, eyes and digestive tract. History of suicidal attempts or ideation. Type 1 diabetes mellitus, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition. In this condition, the pancreas makes little or no insulin. Diabetic ketoacidosis is a life-threatening problem that affects people with diabetes. It occurs when the body starts breaking down fat at a rate that is much too fast. The liver processes the fat into a fuel called ketones, which causes the blood to become acidic. Special precautions. Use in pregnancy and breastfeeding is of unclear safety. Patient with thyroid disease, history of anaphylaxis or angioedema with another GLP-1 agonist, obesity secondary to endocrinological or eating disorders or treatment, Saxenda. Not recommended for use in patients with congestive heart failure, inflammatory bowel disease, and diabetic gastroparesis. Renal and hepatic impairment. Children, elderly, when used for weight management. Drug interactions. Increased risk of hypoglycemia with insulin and sulfonylurea. May affect the absorption of concomitantly administered oral drugs due to slow gastric emptying. May enhance the adverse effect of other GLP-1 agonists. Side effects. Common side effects include low blood sugar, nausea, dizziness, abdominal pain, and pain at the site of injection. Gastrointestinal side effects tend to be strongest at the beginning of the treatment period and subside over time. Other serious side effects may include medullary thyroid cancer, angioedema, pancreatitis, gallbladder disease, and kidney problems. Brand names that are mostly prescribed by doctors. Saxenda, Victoza. Warnings. Victoza is not a substitute for insulin. Saxenda is not indicated for the treatment of type 2 diabetes mellitus. Do not switch between brands. Do not use Saxenda and Victoza together. What foods should be avoided while taking this insulin? It is advised to limit alcohol intake since it may worsen the side effects and increase the risk of developing low blood sugar levels. Combinations. Zoltofy insulin. Zoltofy injection is a combination of two antidiabetic medicines, liraglutide and insulin degludec. Liraglutide helps your body make more insulin during meals and lowers the amount of sugar produced in your body. Insulin degludec works like your body's natural insulin. It facilitates the reuptake of glucose in muscle and fat cells and also blocks the release of glucose from the liver. Together, the two medicines provide consistent, all-day sugar control. Frequently asked questions: is liraglutide good for weight loss? Effectiveness. Liraglutide has been evaluated into double-blind studies of more than 3,000 obese or overweight patients with hyperlipidemia, hypertension, or diabetes. In both studies, adding liraglutide to lifestyle counseling for 1 year resulted in an average of 8.9 to 13.3 pound, 4 to 6 kilograms, greater weight loss. What happens when you stop liraglutide? Upon stopping Saxenda, liraglutide, people are likely to regain the weight lost. This is why it's important to work with your provider to learn how to use diet and exercise to maintain your weight. Directions for use. Injection pen. Inject the medicine subcutaneously, under the skin, in the abdomen, thigh or upper arm. Take it preferably with a meal since it lowers blood sugar levels and may cause gastrointestinal side effects. Store the injection pen in a refrigerator or at room temperature and use it within 30 days. Do not freeze the medicine. Dosage. Subcutaneous. Type 2 diabetes mellitus. Adult, as an adjunct to diet and exercise. Monotherapy or in combination with other antidiabetic agents. Victoza initially 0.6 mg once daily for 1 week, then increase to 1.2 mg once daily, may further increase to 1.8 mg once daily after at least 1 week of treatment with 1.2 mg daily dose if additional glycemic control is required. Child greater than or equal to 10 years, Victoza same as adult dose. Subcutaneous. Weight management. Adult, as an adjunct to a reduced calorie diet and increased physical activity in patients with a body mass index greater than or equal to 30 kilograms per square meter, obese, or greater than or equal to 27 kilograms per square meter to less than 30 kilograms per square meter, overweight, with at least one weight-related comorbidity. Saxenda initially 0.6 mg once daily, may increase in increments of 0.6 mg at weekly intervals up to a maintenance dose of 3 mg once daily. Discontinue treatment if patients have not lost at least 5% of their initial body weight after 12 weeks on a 3 mg per day dosing. Subcutaneous. Weight management. Child greater than or equal to 12 years, as an adjunct to a reduced calorie diet and increased physical activity in patients weighing greater than 60 kilograms or with a body mass index corresponding to greater than or equal to 30 kilograms per square meters for adults, obese, by international cutoff points. Saxenda same as adult dose. If the 3 mg maintenance dose is not tolerated, reduce it to 2.4 mg daily. Discontinue if the 2.4 mg dose is not tolerated. If the patient cannot tolerate an increased dose during dose escalation, consider lowering the dose to the previous level. Discontinue treatment if patients have not lost at least 4% of their initial body weight after 12 weeks on a 3 mg per day or maximum tolerated dose. Monitoring parameters. Monitor heart rate, plasma glucose, triglycerides, renal function, HbA1c at least twice yearly in patients with stable glycemic control or quarterly in patients not meeting treatment goals or with changes in treatment. Signs and symptoms of pancreatitis, gallbladder disease, worsening depression, suicidal thoughts and behavior, body weight, for weight management. Mechanism of actions. Liraglutide is an acylated synthetic glucagon-like peptide 1 analog. Liraglutide is an agonist of the glucagon-like peptide 1 receptor which is coupled to adenylate cyclase. The increase in cyclic AMP stimulates the glucose-dependent release of insulin, inhibits the glucose-dependent release of glucagon, and slows gastric emptying to increase control of blood sugar. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.